Hello everyone, good morning. So this is Baby. I'm back with a new video for Navodaya staff nurse. So this is the one of the model papers specially focused on cancers, guys. So this is oncology. So I try to make videos on separate systems and departments like musculoskeletal system and respiratory system and oncology namely. So let's start the video. Before starting the video, don't forget to subscribe our channel and turn the bell icon so that you get notification regularly. So the first question, which type of cancer has poor prognosis? They'll give you 4 options obviously. So the correct answer is pancreatic cancer. So pancreatic cancer has poor prognosis. If the patient gets this cancer, even though he takes surgery, or if he undergoes surgery, or even if he takes proper treatment, still there are least chances to survive. So that is the meaning of prognosis. Next, second question, most common route of initial metastasis for carcinomas is. So the carcinoma or the cancer starts in one part of area. So next it spreads to other organs. So obviously, so what the route it will be what is the route that will be choosing by the cancer to transfer to another part of the body? So through lymphatic spread. So through lymph nodes, this cancer cells will travel to another part of body and spreads the cancer. Next, third question, most common site of metastasis is. So if the cancer is in lung, or the cancer has affected organ, something like kidney or something like that, so what is the other part it will choose to spread firstly or initially? So that is lung. Lung is the common site for metastasis. Next is fourth question, onion skin appearance is present in. So all carcinomas show a specific characteristic symptom. So they exhibit a particular clinical manifestation. So what is the onion skin appearance, or in which type of carcinoma does this skin appearance is seen? So it is Ewing's carcinoma. In particular type of this carcinoma, we can see the onion skin carcinoma. Next, organism responsible for cervical cancer is. You all know cervical cancer is most common in women. So after breast cancer, next the most common or dominant cancer seen in women is cervical cancer. So the virus that is responsible for this cervical cancer is human papilloma virus. HPV virus is very common causative organism taken for cervical cancer. Next, respite care means. So we all know there are different types of care, hospice care and that care and this care. So what is respite care? So answer, part-time supervision of patients with chronic conditions. So we can see such as chronic conditions like gastrointestinal disorders, stomach cancers or other cancers. So these are chronic conditions. So we'll take the supervision of these particular patients for part-time. So that is called respite care. Next, seventh question, insertion of radioactive implants directly into the tissue is known as. So I have said these are all the questions based completely on oncology. So it is also related to radiation. So we all know if a person gets cancer, they will be having 3 chances to get like treatment. Either they can go surgical or medical or radiation. So a radioactive substance is directly implanted into the tissue so that the patient cancer is under control. So that is brachytherapy. That is called brachytherapy. Next, 8th question, chemo port is used to administer chemo drugs in case of. So chemo drugs, we are all very have acquaintance with this chemo drugs. What are these chemo drugs used for? So chemo drugs, regular administration of these chemo drugs need a chemo port. So we usually see chronic conditions which require long cycles of chemo. So chemo port is used for such clients. So the clients who are suffering from chronic conditions and require a long-term cycle of chemotherapy, then chemo port is useful for those candidates particularly. Next, question number 9, the common surgical intervention for cervical cancer is. So what is a common surgical intervention for cervical cancer is? We all know cryosurgery. Cryosurgery is a specific surgery where the cancer cell are frozen and they will be taken out by this cryosurgery. So it is the first or the most common surgical intervention used if the female is affected with the cervical cancer. Next, 10th question. The normal parameter of PSA, that is prostate specific antigen in males, is. So we all know if the person is having prostate cancer or prostate hypertrophy, we all know we'll send a particular biochemistry test, that is prostate specific antigen test. So what is the normal parameter of this PSA? So it is less than 4 nanogram per ml. So if the antigen is less than 4 nanogram per ml, then the person is normal. If the antigen is more than 4 nanogram, then obviously the patient is susceptible for prostate cancer. So the bonus question for you guys, for the viewers, the confirmatory test for cervical cancer is, we all know there is at least one confirmatory test for every disease condition. So what is the confirmatory test for cervical cancer? So if you know this, please comment down your answer in the comment section. So subscribe our channel.